Anybody who can try the step of cholesterol synthesis, he will be honored or she will be honored. Anybody who has learned from the backbenchers? Yes, Tucker is good boy. Yes, tell me, what was the mnemonic first? High miss. Yeah. H for? Yeah. I for? High miss. M for melanate. Then C for cholesterol. Right. So it is very difficult to remember the steps. The mnemonic was high, miscellaneous. Right. High for the first step is synthesis of HMG CoA. Right. Then M is second step. It is synthesis of melanate. Right. Then I comes. It is synthesis of isoprenoid units, right? Then that S, synthesis of squalene, right? Then C is synthesis of cholesterol. Right? Please get good marker, not working. HMG CoA, how was it synthesized? And C for cholesterol synthesis and C for cytosol. It happens in cytosol, right? And the first step is synthesis of HMG CoA, and the raw materials are 3. One is NADPH, second is ATP for energy. NADPH will provide reducing equivalents, ATP will provide energy, and the third is acetyl CoA. And what is the function of acetyl CoA? It will provide carbon atoms, right? And from we will start the cholesterol synthesis from acetyl CoA, right? So how will you move from acetyl CoA to HMG CoA? First of all, we use 2 molecules of acetyl CoA. So what will you get? Acetyl CoA, right? Then again another molecule of acetyl CoA is added, will get HMG CoA. Right? Now this is the first step, high miss HMG CoA, right? From HMG CoA will synthesize melanate, right? And this requires the enzyme HMG CoA reductase, right? This is the main regulatory enzyme for cholesterol synthesis. This is 6 carbon, this is again 6 carbon, and this is 5 carbon, right? From melanate we will synthesize isoprenoid units, right? They are 5 carbon, right? And they are basically 2, IPP, and the second one is, Tucker, can you recall me? DPP, right? And they will combine to form 15 carbon, that is fattycyl or carbonycyl, tell me. And then 15 carbon will combine 15 carbon to form this squalene, 30 carbons, right? From 30 carbon will reduce to form cholesterol, that is C27H45OH, right? And we also did the structure of the basic steroiding. What was the formula? Cyclopentano per hydrophenon 3 nucleus, right? And the 3 member markers की बहुत प्रॉब्लम है यहाँ पे. And we have first is 6-membered ring, then again another 6-membered ring, then another 6-membered ring, and then a 5-membered ring, right? To this 5-membered ring, a side chain is attached which contains methyl groups. So this is the basic structure of the steroid ring, right? So we started from acetyl CoA, right? And ultimately we build C27, 27 carbon atom, right? So raw materials were 3. For the building of carbon atoms we use acetyl CoA, right? For energy we used ATP. For reducing equivalents we use NADPH. From where you will get NADPH? You get it from HMG shunt, right? And how to remember the compartment of the cell? C for cholesterol and C for cytosol. It happens in cytosol, right? And for the synthesis of HMG CoA, the first 3 steps are acetyl CoA, acetoacetyl CoA, and HMG CoA, right? These steps are same as ketone body synthesis, right? But the enzyme is different. This is cytosolic and this is mitochondria, right? That will be cytosolic HMG CoA reductase. That will be mitochondrial HMG CoA reductase. The compartment is different. The cell is the enzyme is different, but the name is same, right? One functions in the cytosol, other functions in the mitochondria. So that was the brief overview of cholesterol synthesis. So today we'll start with the breakdown, right? See the slide. The steroid nucleus ring structure of cholesterol cannot be broken down by humans, right? And 50% is converted to bile acids and excreted in feces. And it also serves as precursor for synthesis of steroid hormones, vitamin D, coprostanol, and cholestanol, right? And the later 2 are fecal steroids beside cholesterol. So, to break down cholesterol, just see diagram first, the steps. These are the steps. So, today we are doing degradation, right? ये ना बहुत हिलता है इनका, कल बोला भी था इनको। मार्कर कोई और है? Right? So we're starting from cholesterol. It is first converted to 7-hydroxy cholesterol. Right? Through multiple steps, it will form cholic acid and chenodeoxycholic acid. Right? So, do you find difficult to differentiate between bile salts and acid? Just tell me. This is bile salt, this is bile acid. You find difficult? I found difficult in my time. Do you know mnemonic for that? Anybody who has made? Just see, the mnemonic is AS. Right? A for acids and then S for. So how will you remember? First you will form acids, then it will form salts, right? During the degradation of cholesterol, right, we will first form bile acids, right? Then they will combine with sodium and potassium salts to form bile salts, right? The mnemonic is ASS, right? Now start, we have cholesterol. It is first converted to 7-hydroxy cholesterol. Later, by multiple steps, is converted to cholic acid and chenodeoxycholic acid. What was the mnemonic? AS. A for acid. These are bile acids, right? And moreover, they are further conjugated with glycine and taurine. We discussed the metabolism of glycine. Hope you remember. And functions included was conjugation, right? Thank you. So when it will conjugate with glycine, cholic acid, what will you get? Glycocholic acid. And when conjugate with taurine, you will get taurocholic acid, right? And further by intercellular bacteria, it is converted to deoxycholic acid, right? In the same manner, this is chenodeoxycholic acid, and again conjugated with glycine or taurine. What will you get? Glyco-chenodeoxycholic acid or tauro-chenodeoxycholic acid, right? Tauro or glyco-chenodeoxycholic acid, right? Later by intercellular bacteria, it is formed lithocholic acid, right? So this is degradation of cholesterol, right? How it is degraded? It is not fully degraded. The steroid ring is not fully broken off. 50% is converted for the use of vitamin D, steroid hormones, sex hormones as well, right? And some part is broken down to form bile acids, right? And later these bile acids are converted to form bile salts, right? And there are two types, primary and secondary, right? So see, seven alpha hydroxylase inhibited by bile acid rate limiting reaction, right? So cholic acid and chenodeoxycholic acid are primary bile acids, right? Cholic acid and chenodeoxycholic acid, they are primary bile acids. On conjugation with glycine and taurine, they will form glycocholic and taurocholic, which are more efficient surfactants, right? So these two are this one and this one. They are primary bile acids, right? After conjugation with glycine and taurine, they will form secondary bile acids. In the same manner, it is a primary bile acid conjugation with glycine and taurine will form secondary bile acid, right? Remember the mnemonic AS. Acids will be formed first, then salts, right? Same steps. Cholesterol, 7-alpha hydroxylase will get 7-hydroxy cholesterol, right? Via several steps, it will form the first cholic acid and chenodeoxycholic acid, right? Then it will conjugate with glycine or taurine to form glycocholic acid and taurocholic acid. In the same manner, chenodeoxycholic acid with taurine or glycine will form tauro or glycochenodeoxycholic acid. Later, by intercellular bacteria, it will form lithocholic acid and deoxycholic acid. What is enterohepatic circulation? You will get question in this minimum 3 marks question or you can get also YO from this defined enterohepatic circulation. It is very important, and it is also important in the role of gallbladder or gallstones, right? So let's discuss this first. I am not good in anatomy, I am already telling, right? So don't make fun of my diagrams. I am trying my level best to explain, right? So this is a liver, and we can imagine a gallbladder here. Right? This black one is our gallbladder, right? And the bile salts are synthesized in liver. Right, we are synthesizing bile salts in the liver, right? And later they accumulate where? In gallbladder, right? They are synthesized in the liver and stored in the gallbladder, right? From there they are secreted to the small intestine, right? And here they act as emulsifying agents and also help in absorption of fats and fat soluble vitamins, right? Right, the bile salts are synthesized in liver, clear, stored in gallbladder, right? From here they are secreted into the small intestine, where they act as emulsifying agents and help in absorption of fats, fat soluble vitamins as well, right? What happens after that? These bile salts are later recycled, right? After recycle, they will again enter where? See the diagram. Through portal vein, suppose that it is a portal vein, right? Through portal vein it will again enter the liver, right? See clearly, the conjugated bile salts synthesized in liver accumulate in gallbladder, right? So bile salts synthesized in liver, stored in gallbladder, right? Later on, from there they are secreted into small intestine, right? Where they serve as emulsifying agents for digestion and absorption of fat soluble vitamins, right? Bile salts made in the liver, stored in the gallbladder, they are excreted into the small intestine for absorption and emulsification of fats. Absorption of fats, fat soluble vitamins. Okay. Later they are recycled back into the main organ via portal vein, right? The bile salts are recycled and reused several times a day, right? And this complete process is known as enterohepatic circulation, right? And remember one thing, 15 to 30 gram of bile salts are secreted into the intestine, right? Each day. So daily, how much? 15 to 30 gram, right? And each day reabsorbed only 0.5 gram is lost in stool, Out of this complete circulation, 0.5 gram is lost in stool or feces, right? And to replace this lost bile salts, fecal excretion for routine removal of, ये routine में cholesterol remove करेगा ऐसे, right? Now tell me, this is clear to you or not? We discussed synthesis of cholesterol in the previous class. In breakdown of cholesterol, right? First we form, tell me the steps, bile acids, right? Later they were conjugated with glycine and taurine to form secondary bile acids, right? Later they form salts with sodium and potassium to form bile salts, right? And now see this impact. This is breakdown of cholesterol, and these bile salts we formed 15 to 30 gram every day. Where? In the liver, right? They are formed in the liver, stored in the gallbladder, right? From the gallbladder, they are excreted every day into the small intestines. In the intestine, what is their function? They act as emulsifying agents. They help in absorption of fat-soluble vitamins, right? Right. After that, they are recycled back to the original organ where they are formed via portal vein. So this complete is enterohepatic circulation. Please take screenshot, save it. It will make it easy for you. Okay. Please send कर देना मुझे बाद में. And now 15 to 30 gram is daily excreted and 0.5 gram is lost in stool. Rest is recycled again and resynthesized to maintain this level proper. Now what will happen when this level is not proper maintained? Tell me, anybody who can guess? Anybody who can try? Backbenchers? So cholesterol was broken down to form first bile acids. Primary bile acids they converted into secondary bile acids, right? Later they form sodium and potassium salt to form bile salts, right? And these bile salts are formed in the liver, stored in the gallbladder, right? Later they are excreted into the small intestine. This is complete breakdown of cholesterol, right? Now I'm moving into the enterohepatic circulation. So made in the liver, stored in the gallbladder pumps, they come into the small intestine. Here they act as emulsifying agents, help in absorption of fat-soluble vitamins, right? Used, 0.5 gram of them are lost in stool. Later they are recycled back into the liver via portal vein, and this complete process is enterohepatic circulation, right? We have finished up to this. Now I told that 15 to 30 gram is maintained, right? And 0.5 gram is lost in the stool. But when this level is not properly maintained, what will happen? Please try. Kunal Gupta ji, please try. What will happen? Any guesses? Very common these days. Anushka is feeling sleepy, I think so. The cholesterol in gallbladder will precipitate and will form gallstones. When this enterohepatic circulation is not properly maintained, right? Now we'll discuss the mechanism in detail. Bile salts and phospholipid are responsible for keeping cholesterol in bile in soluble state, right? And due to deficiency of bile salts, cholesterol crystals precipitate in gallbladder, resulting in cholelithiasis, right? Or cholesterol gallstone disease, right? And cholelithiasis may be due to defective absorption of bile salts from intestine. 15 to 30 gram were secreted into the small intestine, right? After absorption of fat, they will come back to the liver. This is enterohepatic circulation. But when they are not effectively absorbed back into the liver, into the gallbladder, what will happen? Cholesterol in the bile will precipitate because of deficiency of bile salts. That will result in the formation of gallstone or cholesterol gallstone disease, or known as cholelithiasis, right? Cholelithiasis may be due to defective absorption of bile salts from intestine, impairment in liver function, and obstruction of biliary tract, right? Patients with cholelithiasis respond to administration of bile acids, chenodeoxycholic acid, commonly known as chenodeoxycholic, right? So this was the liver, and this was black one was gallbladder. The gallbladder was storing these bile salts, right? From here they were secreted into the small intestine, where they act as emulsifying agents and help in absorption of fats and fat soluble vitamins, right? Later they are, after doing their work, they will move back into the liver via portal vein, and this complete process was enterohepatic circulation, right? And bile salts कहाँ से आए थे? From breakdown of cholesterol to form primary bile acids, then secondary bile acid, then they form salts with sodium potassium to form bile salts, right? And these bile salts normal daily कितने होंगे excrete? 50 to 30 gram, right? And 0.5 gram are lost in the feces, and rest they come back to the liver. This was complete enterohepatic circulation and degradation of cholesterol. Now, when the bile salts level decrease due to improper circulation, what will happen? The cholesterol in the gallbladder will precipitate due to decreased level of bile salts, and right. So when cholesterol is precipitated, it will form gallstones in the gallbladder, right? And this is known as cholesterol gallstone disease or cholelithiasis, right? And the problem, nip the evil in the bud, we discussed earlier, right? Problem is coming from which source? Decreased level of bile salts, right? So when you will give them medicine in the form of bile salts, right, the level will become normal, and the precipitated cholesterol will again solubilize, right? It can be corrected, right? And in severe cases, it causes great pain. What will you go for? You will go for surgery and remove the gallbladder. Any drawbacks of surgery? Any drawbacks of this surgery? Any drawbacks of this surgery? If you remove your gallbladder, right, get it done. After that, any drawbacks? Arif, can you try? We cannot break down fats, major problem, right? And these fat soluble vitamins you have to take in supplement form, because your body bile salts will not be formed, they will not help in emulsification, they will not absorb fat soluble vitamins. When they are not absorbed, we will become deficient in fat soluble vitamins A, D, E, K. Deficiency of D will cause what? Decrease in calcium absorption, you will can go into osteoporosis as well. K, E, anti-sterility, A, good vision, all problems will come. So you will have to take in the supplement form all the fat soluble vitamins, right? And you cannot eat oily foods because you don't have gallbladder to digest it, right? Two drawbacks will come. So I hope enterohepatic circulation is clear to all of you. If you have any questions, please ask me. We started from breakdown of cholesterol, right? 7-hydroxycholesterol. Then we form primary bile acids. Then form conjugation with glycine and taurine, secondary bile acids. Then they form sodium potassium salts known as bile salts, right? Later these bile salts, they are formed in the liver and stored in the gallbladder. From the gallbladder excretes and pumps it into the small intestine. In the small intestine, what they do? They help in absorption of fats, emulsification and all this. After that, 0.5 gram is lost in the feces. Rest come back to the liver via portal vein, portal circulation. This complete process was enterohepatic circulation, right? Daily how much? 15 to 30 gram and 0.5 gram is lost in feces. When this delicate balance is not maintained, what will happen? In the gallbladder, the cholesterol will precipitate. And this precipitation will cause gallstones, and the condition is known as cholesterol gallstone disease or cholelithiasis. Clear? And how will you treat it? Because you have decreased level of bile salts, you will supplement with bile salts. Again, slowly it will come to normal level, or if immediate relief is needed, you get the surgery done. Right? All clear now? And moreover, we synthesize steroid hormones from cholesterol. Any names? Glucocorticoid, cortisol, mineralocorticoid, aldosterone, progestins, progesterone, androgens, testosterone, estrogens, estradiol, right? The 50% was used that was used for this, right? And it is also used for synthesis of vitamin D. 7-dehydrocholesterol intermediate in synthesis of cholesterol is converted to cholecalciferol vitamin D3 by ultraviolet light in the skin, right? And now coming on to transport of cholesterol, 70 to 78% is in a esterified form with long chain fatty acids, right? And 25 to 30% as free cholesterol, right? And this form of cholesterol readily exchanges between lipoproteins and cell membranes, right? And now coming on to the role of LCAT. We discussed phospholipids in earlier classes. Anybody who remembers the structure of phosphatidylcholine, LPC, we did the mnemonic for that. That was very rich in yellow part of the egg yolk. Hope you remember that phospholipid. Anybody from the backbenchers? Can you tell me the name, exact name? Anybody from this side? Arif, please tell me the name. Please stand up. Debolina, please help. Yes. Second CR, bol beta. Phospholipids. Lecithin. Yes. Good boy. Please clap for him. Yes. Yes. Bas karo. ठीक है. So it is all clear. Now we'll start with the next topic. Lecithin was phosphatidylcholine. LPC was the mnemonic, hope you remember. And choline is present in yellow part of the egg yolk, right? And this is a phospholipid. And hope you remember the previous class, when 3 carbons are there and 3 O's are there. What is this? क्या करो तुम लोगों का? Glycerol. Glycerol. And the parent phospholipid was phosphatidic acid. I told you from phosphatidic acid we can form all the phospholipids. So we can form phosphatidylcholine as well. 1 ol, 2 ol, 3 ol. Glycerol. 1 acyl group, monocyl. 2 acyl group, diacyl. And you attach phosphate here. What is that? Phosphatidic acid. Then attach a choline, right? CH2, CH2, and CH3, CH3, 3J3. So this is choline group. What will you get now? Phosphatidylcholine. We have fatty acid 1 here, 2 here with the acyl group, and this is phosphate and this is choline. This is the basic structure of lecithin. Now we are using it in our clinical approach via LCAT. LCAT, lecithin cholesterol acyl transferase. What is the function? It plays a major role in reverse cholesterol. Why are you talking? Reverse cholesterol transport. Anybody who can tell me the meaning of reverse cholesterol transport? Please try. Bilaspuria, can you try? Yes. साथ वाला तेरा किधर है? कल उसने पेपर अच्छा किया है, किधर गया वो? Where is he sitting? वो साथ में बैठा है, चेहरा छुपा रहा है. खड़ा हो जाए यार, ऑनर होला. बोलो. What is reverse cholesterol transport? पढ़ के आई हूँ, बैठो. Reverse cholesterol transport. We have extra cholesterol in the whole body, and you are bringing it back into the liver. If you have extra cholesterol in the body, what will it cause? Problem or trouble? It can accumulate in arteries. What will it cause? Atherosclerosis. It can lead to CAD or CHD, right? But when you are doing this mechanism efficiently, reverse cholesterol transport, excess cholesterol is pulled back into the liver. So this is known as reverse cholesterol transport. And how it is done? It is done by lecithin and HDL. What is HDL? High density lipoprotein. It is called good cholesterol, right? Good because it removes cholesterol from the whole body and brings back it into the liver, right? So it will highly desirable lipoprotein because good because it prevents us from heart disease, right? So how will you manage it? We'll do it via reverse cholesterol transport. So see, HDL enzyme lecithin cholesterol acyl transferase are responsible for transport and linkage of cholesterol from the body. You have extra cholesterol circulating in the whole body, right? Both of these two, lecithin, LCAT and HDL, they will bind to it and bring it back into the liver. The excess circulation is not good for the body because it will clog the arteries, right? So this is known as reverse cholesterol transport. How it is done? See the mechanism. And those who go to gym, the bodybuilders advise them to not to eat yellow part of the egg. Now how will you justify? They are illiterate. If you eat yellow part, you will lose more fat. You will become more healthy. Yellow part is even more healthy than white part. Now you can understand. Let's speak. LCAT is a plasma enzyme synthesized in liver, right? And it catalyzes the transfer of fatty acid from second position of phosphatidylcholine to hydroxy group of cholesterol. See the diagram. No noise, no movement at the back. This was choline, this complete was phosphatidic acid, and this complete was lecithin, right? And now we are doing reverse cholesterol transport, right? And we are also using HDL, high density lipoprotein. Now see the mechanism what I have written. It catalyzes the transfer of fatty acid from second position of phosphatidylcholine to hydroxy group of cholesterol. We have fatty acid at carbon number 2, right? It transfers the fatty acid from second position of this phosphatidylcholine to hydroxy group of cholesterol. Suppose I draw the structure of cholesterol like this, basic structure. This is the basic ring, right? From second fatty acid, it is transferred via hydroxy group to the cholesterol, right? So this fatty acid is trapped in the HDL via this reverse cholesterol transport, right? Just see. HDL cholesterol real substrate for alkat, right? This was lecithin cholesterol side transferase, fatty acid carbon 1 at 2 and choline at carbon 3, right? And this fatty acid was transported to hydroxy group of cholesterol and it is trapped here. So HDL cholesterol real substrate for alkat and this reaction is freely reversible, right? Alkat activity is associated with ApoA1, this all the APOs, and we will discuss in the next class in lipoproteins. I am just giving the overview of that, right? And the cholesterol esters form an integral part of the HDL. The fatty acid from this is trapped in this molecule, right? So in the outer body where it is circulating, it is trapped and brought back here into this, right? And then trapped in HDL by reaction catalyzed by alkat, we discussed it, and transported to liver for degradation and excretion, right? This is known as reverse cholesterol transport. I discussed it. Maybe over. So this was bile acids and this is bile salts, right? Primary and then secondary, right? This was the overview of the degradation to form bile acids, right? And what is the biomedical importance of cholesterol? Is it good or bad? Good or bad? Who is talking at the back? No noise. Total plasma cholesterol is 150 to 200 milligram per deciliter, right? And in newborn it is 100 milligram, right? Less than, and rises up to 150 by 1 year. And women have less plasma cholesterol, which is estimated to estrogens. And cholesterol level increase with increasing age and after menopause and pregnancy, right? And how will you do estimation? You had discussed this reaction, how to calculate in the practicals. I will try to revise in just short time. The name of the method is Lieberman-Burchard reaction, and the Karl-Drucker method, and one is cholesterol oxidase method, right? And HDL can be determined by, ये बताता हूँ आपको reaction. We have, when you go for lipid profile reports, what are the tests done? Cholesterol, triglycerides, HDL, LDL and VLDL. How much you pay? Approximately 600 to 700 you pay, right? If you go for only 3, I will help you calculate the rest of you. You can pay, you can save 300 to 400. You only go for 3 investigations, right? When you divide TG by 5, you will get VL, DL, very low density. So you have values of TG. When you divide by 5, you will get the VLDL. It is calculated value, right? And how will you calculate LDL, right? Total cholesterol is there, right? And this is how you can calculate LDL, right? Total cholesterol is there. You minus it from the sum of HDL and TG और 5 is VLDL plus HDL. इनका total करो and minus it from total cholesterol. You will get your LDL levels, right? And this equation is not valid when triglyceride levels are greater than 400 milligram per deciliter, right? In that case, you have to dilution method. After that, you can run the sample, right? And now cases of hypercholesterolemia. First reason is diabetes mellitus. Now please tell me why in diabetes mellitus the cholesterol level increase. We have discussed all the, just I will recall you. Anybody who can make guess, it is written, a hint is written there. Tell me, just try. Dhruv, will you try? Will you try? Why the levels of cholesterol increase in diabetes mellitus? Why? Anybody who can try. During diabetes, you will get excess amount of acetyl CoA, right? And this acetyl CoA, we combine another molecule acetyl CoA to form acetyl CoA. This again combines with another molecule of acetyl CoA to form HMG CoA. And this HMG CoA will lead to synthesis of cholesterol, right? How high? Miscellaneous. Now you can understand, during diabetes, the level of acetyl CoA increase, right? And excess acetyl CoA will do what? It will combine with another molecule acetyl CoA to form acetyl CoA. Then another molecule acetyl CoA will form HMG CoA. And HMG CoA will lead to synthesis of cholesterol because it is precursor for the synthesis of cholesterol. So automatically in diabetes mellitus, the level of cholesterol increase. So why hypercholesterolemia? Now you know the exact mechanism, right? And second case is hypothyroidism. In that same manner, due to decrease in HDL receptor on hepatocytes, right? Due to obstructive jaundice, there is obstruction in the excretion of cholesterol through bile. These are the mechanism. And also in nephrotic syndrome, there is increase in plasma globulin concentration. And characterized feature of nephrotic syndrome, the cholesterol elevation is due to increase in plasma lipoprotein fractions, right? So when you will get asked question about name the conditions or diseases in which the cholesterol level increase in the body, first is diabetes mellitus, second nephrotic syndrome, third is hypothyroidism, and fourth is nephrotic syndrome, right? Now, good and bad. What is good? HDL. Bad is LDL. How will you remember HDL as good? HDL is H, highly desirable lipoprotein, right? And LDL is lethally dangerous lipoprotein. It is good and it is bad, right? And HDL is positively correlated and HDL negatively correlated with heart disease, right? When you go for lipid profile reports, if your HDL levels are high, it is a good report, and if LDL levels are high, it is not a good sign. It is a sign of hypercholesterolemia, right? You will have blockages in your arteries and you can further go for heart attack, right? And I told HDL is a highly desirable and LDL is lethally dangerous lipoprotein, right? And how the lifestyle affects the level of cholesterol. If you don't exercise, the level will automatically increase. If you have obesity around the abdomen, it is also indicative, right? And other parameters are high blood pressure, emotional stress is there. If you smoke, then drinking of lot of soft drinks, Coca-Cola, all these things, lack of exercise, obesity around the abdomen, and serum cholesterol will be high, right? And how will you decrease or control? How will you decrease or control the levels of cholesterol? Tell me, anybody? First thing is that you can eat lot of fiber or salad. they will also help in removal of the cholesterol, right? First is consumption of polyunsaturated fatty acid, right? उसमें क्या होता है? They will help in reverse cholesterol transport, right? And dietary cholesterol less than 300 है तो medicine कौन सी लोगे? These are the two. They influence the cholesterol. You avoid food rich in. If you are already having high cholesterol level, you will not consume foods that are high in cholesterol, right? And plant steroids like cytosterol, they reduce the plasma cholesterol levels by inhibiting the intestinal absorption of dietary cholesterol. I told the enterohepatic circulation to you, and from there they are recycled, right? But these two plant steroids, they will decrease the absorption of cholesterol from the intestines, right? And dietary fiber also plays a role, decrease the absorption of cholesterol from the intestine, right? And one or more thing, you do exercise, you keep a healthy lifestyle, right? Avoid high carbohydrate diet, right? And lifestyle, abdominal gases should not be there, you should exercise, stress should be low, BP should not be high, right? And drugs, statins are the first choice of drugs. Statins कहाँ पे target करते थे? At the first enzyme, HMG CoA reductase. HMG CoA reductase. We discussed in the previous class the mechanism of, right? So HMG CoA acts there, decrease cholesterol synthesis. Statins taken at has next, and statins should be taken at night. At that time, the activity is high, right? And hypercholesterolemia. We discussed hypercholesterolemia. Now we are discussing hypo. Hypo means less. It happens during hyperthyroidism, pernicious anemia, malabsorption syndrome, right? What is written? It is friend, not enemy, right? Why? 1970s में रिसर्च आई, हैरिसन वाली बुक आती है, हमारी बहुत पुरानी है, तो उसमें इन्होंने ना कुछ पेमेंट ली अच्छी मेडिसिन वाली कंपनी से, तो उन्होंने बोल दिया जो हमारा देसी घी है इट्स बैड बिकॉज इट इज़ हाई इन कोलेस्ट्रॉल, राइट? और उन्होंने अपना डालडा प्रमोट करवाया, डालडा, ठीक है? और आफ्टर दैट द इंसिडेंस ऑफ हार्ट अटैक्स इंक्रीज, ट्रंकल ओबेसिटी इंक्रीज, ऑल दैट प्रॉब्लम्स केम, एंड लेटर ऑन आफ्टर 30 years they take U-turn, right? So our desi diet, you can say desi ghee is good, butter is good, flax seeds are good, chia seeds are good. If you go for any refined product, refined oil, refined means it is refined, so it will cause increase in cholesterol levels, right? And majority of people say that heart attacks were found to have normal, the patients who do have heart attack, they have normal cholesterol levels, and cholesterol was the biggest scam of that time, right? And you can incorporate and become healthy by cholesterol-rich foods, which eggs, seafood, animal fat, and oils in which are rich in fish oil, right? These are all good fats, right?